Hi everyone, my name is Garrett Myers and today I'll be presenting Tourette syndrome. Tourette syndrome is a condition of the nervous system. People who have Tourette syndrome usually experience tics, which are sudden twitches, movements, or sounds that are out of the ordinary. They're usually uncontrollable and repetitive. There's two types of tics. There are motor tics and vocal tics. Motor tics are movements of the body such as blinking, jerking, or shrugging. And vocal tics are sounds made by that person, which would include humming, yelling, and shouting. There's two types of tics. There can be simple tics or complex tics. Simple tics involve a few body parts, which would be like sniffing or squinting your eyes. Complex tics include several body parts, so bobbing the head and jerking the arms while jumping. The symptoms of Tourette syndrome usually begin around ages 5 to 10. And usually start as motor tics in the head and neck region. The tics worsen when the child is excited or stressed, but can be improved when the child is calm or focused on an activity. Rare symptoms include caploria, which is the shouting of vulgar words, and echloria, which is the repetition of words said by another person, like they're echoing that person. It is possible for the tics to decrease and sometimes disappear during adolescence and early adulthood. The diagnosis of Tourette syndrome. Tourette syndrome is usually diagnosed by the person's history of signs and symptoms. The criteria include both vocal and motor tics for at least a year. The prevalence of Tourette syndrome usually is 1 out of every 162 children are affected. It's more common in males than females, and it's also more common in non-Hispanic white children. 86% of these children who are diagnosed also are diagnosed with another mental, behavioral, or developmental disorder. The treatments for Tourette syndrome, no cure has been found yet for Tourette's, but medications, behavioral therapy, psychotherapy, and deep brain stimulations all are useful treatments to help prevent Tourette's, the symptoms of Tourette's. What adaptive PE teachers need to know, try to keep the child away from stressful situations because these increase the symptoms of Tourette's. Reduce the amount of stressful activities or activities that may trigger their anxiety. Attempt to ignore the symptoms as possible. This reveals acceptance that can reduce the amount of stress and bullying of the student with Tourette's. Acceptance will help the student focus on their academics rather than suppressing their symptoms. Some activities for children with Tourette's, sports like soccer, tennis, volleyball, are good because it keeps their mind focused on the task and not let their mind wander about their symptoms. Some more sports would be like jump rope or jogging and running. These are my references. Thank you.